There are three things that I use shockwave therapy for: tendon pain, ligament pain, and arthritis. I'll explain what these conditions are, how I treat them, including shockwave therapy, and how the shockwave machine works. And you can just buy one of those yourselves, and I'll put a link down below of where you can get one. And then I'll demonstrate at the end of the video on myself how to properly utilize this type of equipment. My name is Dr. Story. I've been a doctor of chiropractic for over 29 years. I'm going to give you realistic information based on my experience and based on the scientific literature. So what are the conditions that we're talking about that respond well to this type of therapy? The first is a tendon problem, and we're going to call this a tendinopathy, or tendinosis, or tendinitis. All three of those terms can be used interchangeably, but not really, but that's just splitting hairs. Think of a tendon as a rope that attaches the muscle to the bone. So I often use this as a model to show patients what this tendon looks like. A tendon is like this rope. It's strong, but when you pull on it, it has some strength or stiffness to it. The problem is that if we overload what our tendons can handle, then they start to get micro tears. And that's what you see right here. You see how there's a little bit of fraying, and the redness, that's basically bleeding. So over time, your body tries to mend this together by forming some type of new tissue. And that's what you see right here in this second model. You see how there's kind of a sticky, you can't see sticky, but you could feel it, that the body is trying to mend it together, and there's kind of a callus there. Well, over time, then the tendon forms so much scar tissue that now this is scar tissue or adhesions, and this is exactly what happens to a tendon. Now, this is a good way for the tendon to be healed. Unfortunately, athletically, you could see it's not very flexible, and it's hard as a rock. So tendon pain, chronic tendon pain, tends to go through a phase where there is damaged tendon or structures within the tendon itself. A ligament is a connective tissue structure that connects bone to bone, whereas tendon connected muscle to bone. And tendon is very much like a rubber band. So I show this to patients. Now, a rubber band has some pliability, but it will always snap back to its original position. The same thing happens to a ligament. When you sprain an ankle, you sprain a knee, you sprain a shoulder, and you overstretch what the ligament can handle, then there are little micro tears. The body starts to bleed within those tears. It starts to form new tissue from collagen, and then it forms a scar, which is a great way to heal it from a natural point of view. However, the scar will limit the range of motion, and thus you end up with chronic stiffness. The third condition is osteoarthritis. This is not to be confused with rheumatoid arthritis or psoriatic arthritis or enteropathic arthritis. Those are autoimmune diseases. This is a condition called the wear and tear type of arthritis. Now, I don't have a structure here to show you, but what you have to imagine is that every bone that connects to another bone in our body has a joint. And I'm going to use a knee joint right here to show you how this works. This is your femur. This is your tibia, and I'll demonstrate treatment on this in just a moment. But on the edge of the bone right here, there is a soft structure, and I show this to patients that this is kind of rough, but right along the joint, it's nice and smooth. Think of this smooth area as Tupperware, a structure of Tupperware. And then on the other side, where this bone touches this bone here, this has a smooth surface as well. So you have two structures on the ends of the bone that have the same consistency as like a Tupperware. Then imagine someone poured olive oil on each side and then encapsulated it with a water balloon, and inside was the olive oil. That way it's nice and slippery to move. That's what gives our knee a natural ability to move. Well, arthritis is as if someone took an ice pick and just stabbed and shanked the edges of each bone. Now there's holes and a roughened edge there. Now the olive oil can seep in there and it's not functioning well. Now all of a sudden you've got damaged cartilage, and when you bend, all the olive oil or the synovial fluid is inside places where it shouldn't be. This is the mechanism by which arthritis occurs. Okay, so how do you treat a chronic tendon problem? How do you treat tendinopathy? Now, I'm going to use the knee as an example in each of these cases, but this can go for a wrist, an elbow, a shoulder, rotator cuff issues. It can occur all throughout the spine, your hip, your knees, your feet, your ankles. All structures of the body can be treated in the same philosophy. So a tendon problem, here's how you do it. The first principle is you have to get blood supply into the area. Blood carries nutrients and oxygen, and the only way to get something to heal is to bring nutrients and oxygen to that tissue. So a massage around the area where you're massaging into the area where there's a problem. The other thing that works well for tendinopathies is isometric contractions. Now, in the case of a knee, I find that wall sits and sissy squats are very beneficial and provide a lot of pain relief as well as therapeutic value in healing the tendon. The protocol that I use is I have a patient contract a muscle for 20 seconds, give it about a minute off, let them rest, do another 20 seconds, and they want to be doing the contraction at about 70% of their maximum strength. So it's a pretty good contraction, but because there's no movement in an isometric contraction, they don't really get any pain when they're doing it. They'll do 3 to 6 cycles or sets of this once a day, and it can take about 3 months for a person's chronic tendon pain to go away. In my office, I have a Shockwave machine. I will use that twice a week, trying to give about 2 to 3 days in between the treatments. So like a Monday and Friday would be a good example of a treatment protocol. The Shockwave Therapy takes about 5 to 7 minutes in my office, along with other things that I'm doing. Ligament pain requires a little bit of a different type of treatment. The first thing I'm going to do is what's called cross-friction massage on the ligament. So if the ligament fibers are facing in this direction, I will use my thumb and go across the fibers. So not up and down, but crossways to the fibers. This breaks up adhesions in the ligaments and allows the ligaments to become more pliable over time. Ligaments will heal based upon the physical stress that you put them on. So unlike a muscular contraction where you can contract the muscle and pull on the tendon, in a ligament you have to put stress on the joint. So in the case of a medial collateral ligament, I might have the person do side planks with their inside knee, putting most of the stress on that area to strain the tendon just a little bit to apply forces to create more collagen synthesis. Shockwave therapy will very often work wonders in this particular case because you can directly put the shockwave instrument on the damaged ligament and will create a lot of collagen synthesis over time, which of course heals the ligament. In the case of knee arthritis, I will use a shockwave machine directly on the cartilage. Then I will have the patient do exercises that are what are called no-load exercises, which means we're very often tractioning the joint and relaxing the joint and then contracting the joint to allow the fluid, which is the synovial fluid, that olive oil that I was talking about, to get more motion. So movement improves the pain of arthritis. When you do that where there's no compression of the joint, then you get much better results. So for example, swinging the legs with weights on the ankles, or doing something where they're moving the joint but not compressing it a lot. So an exercise bicycle versus running on a treadmill. the running on the treadmill, there would be a lot of compression in the knee, whereas cycling, there's not a lot of compression, but they're getting the movement. Also, changing the alignment of the joint through manual adjustments or arthrostim adjustments can make a world of difference for people with arthritis. So let me demonstrate how a shockwave therapy works. This is a unit that you could buy at home. I'll put a link down below in the description. It's called VITALIZE. Let me turn it on. There's a button at the back here to turn it on. We're gonna fire this baby up. And what this machine does is it produces low energy radial waves to improve healing and help regenerate soft tissue. I'm gonna show you the device and how it works, but this is what you would be applying the edge here to the body part in question. The nice thing is with a unit like this, it comes with various parts right here depending on the body part that you're using. And also I'm going to go through this machine and show you exactly how to use it. Essentially what you want to know is these high energy acoustic waves will promote healing of various tissues in the body. When standard rest and medications just don't seem to work, you need to force the body to heal. And this is a natural way to do it. So let's look at exactly what this is. So there's a gentle, standard, and power things at the top. But then it goes over 12 different areas that you can put this on. You've got your shoulder, your arm, your wrist, your chest, back, waist, hips, ED, thigh, knee, calf, and foot. And I'm going to demonstrate this on the knee in just a moment. But you've got all these areas, and the point of this is it's so simple that these are all preset. Now you can modify things, but I'm going to show you how these presets are really good. So there's a button over here that you could turn it, or you can just, it's a touch screen. But I'm going to bring this over here to the knee, and I'm going to use this as an example. Once I've chosen the knee, I'm going to hit the arrow here. And now this is specific to the knee. Now, what this means here, the preset value in terms of time, this means 3,000 pulsations. It's not 3,000 minutes or 3,000 seconds. The frequency is the amount of times per second that the thing will actually pulse. And the energy is the strength with which it pulses. So you can modify these, so I can go up to 3 bar or 3.5. This machine actually goes up to 10 bar, which is amazing. Okay, that's extremely high. So we're going to go back to 2.5, which is what I would use to start with a patient. So a frequency of 8, the energy is 2.5 bar, 3,000 pulsations. It tells you exactly which head to use. You can interchange these. And what happens is you just turn it anti-clockwise or lefty-loosey, righty-tighty, and this will come off, and you can apply different heads to it that come with the unit, which is really nice. But we're going to go ahead and show you a treatment with this to show you exactly what it looks like. And I'll show you for the tendon, the ligament, and the arthritis how to do this. So I'm going to demonstrate for you how to apply this type of shockwave machine to the knee for the various problems. Let me show you where in the knee most people get tendon pain. It's either on the tip of the knee right here, or it's underneath the knee, which is the most common, or on top. All of these can be called jumper's knee. But essentially, I'm going to demonstrate it right here. So what you're going to do is just take some lotion, just so it's easy on your skin, and just apply it to the area that you're having trouble with. And then what you'll do is you'll turn the machine on. But what you have to do is you have to use the blaster. I call it the blaster when I use it on patients because it looks to me like, you know, Star Wars, a blaster. And this button right here is the area that you have to push so you can manually control it, so you don't have to be next to the machine. So I'm going to place it right underneath the knee, hold it there, hit the button, and you'll feel it. You can definitely feel it. And you can move it around, or you can find the area where it's most sensitive. and you will do it for the duration of the treatment. Now, let's say a person has a medial collateral ligament injury. That's on the inside part of the knee. So you would feel for the inside where the ligament is, find the exact spot. There's some lotion on there. And what you would do is you would place it on there and then go ahead and do that. Doing the treatment. Now for arthritis, it's a little bit different. What happens is, what I find is most people get arthritis on the inside part of the knee. So what I will do is I will use my thumb pressing the kneecap or the patella that way to open up the inside part of the knee. I will place this here and then I will turn the machine on and do the treatment on the inside part of the knee. So those are the protocols that I follow when I do treatment on tendons, ligaments, and arthritis. I use a shockwave, I use various other methods to try to get people to heal better naturally. If you'd like to get one of these, there'll be a link down below in the description, and I hope that this has been informative to you.